Staff shortages, poor patient care, inadequate infrastructure and mismanagement of resources are among the issues that prompted the committee to conduct its own assessment. The investigation also found that the maternity ward lacks sufficient space, forcing new mothers to wait on chairs for beds, which increases their risk of infections and other health complications. The NCOP has emphasized that addressing these issues is work in progress and requires ongoing oversight.
As the Committee of Health of Parliament, National Council of Provinces, we acknowledge the report and also we appreciate the work in progress that they have presented to us. We are saying it's a work in progress in the sense that it is not the total solution to the challenges that they have raised, but we see at least that there are developments that are taking place. For instance, on the question of the question of overcrowding in Dora Nginza specifically, there are means to address it. There is a process of making Mbelweni of going to Gazette Mbelweni Hospital to be a district hospital.
Challenges with staff shortages in Eastern Cape hospitals has been the biggest issue, a concern also highlighted in the Public Protector's report. Eastern Cape MEC for Health and Gqeberha says the department is making efforts to address this by implementing measures to increase staffing and strengthen service delivery.
No, for Dora, we have tried our level best. When it comes to the issue of shortage of staff, you'll be surprised that we've got about 744 nurses employed for Dora only. We've got 148 cleaners for Dora only. So I said when we're dealing with issue of shortage of staff, we must not just be rhetoric, but we must speak numbers so that we are able to say, indeed, there is a shortage here. We agree there is a shortage of staff in the province, and we've been unable to employ, especially for the non-clinical, because remember, for us to employ, it must be approved by the provincial office, treasury, as well as by the premier's office. So we've tabled our request, but it has been rejected.
Clinics in Gqeberha Township have faced ongoing challenges of temporary closure due to rising concerns over the safety of healthcare workers amid criminal incidents, an issue the department says it is looking into.
It is indeed a challenge, but it cannot be a responsibility of Department of Health. We don't deal with security. We deal with patients that are sick. You can't expect, therefore, that when you talk about issue of crime in Nelson Mandela, you attribute that to Department of Health. It can never. But it needs a holistic approach because it does affect us. But fortunately, we've met with MEC Nginza. We've had our meeting. We've agreed that we must continuously engage. But even the community of Nelson Mandela must play their part because those criminals are coming from the communities. They're not coming anywhere else.
Unions that attended the briefing have highlighted the importance of their inclusion in the reports. For SABC News, I am Gqeberha in Gqeberha.